Riverside Pain Physicians.
Doctors say back pain affects most people at some point in their lifetimes, but for some it's so severe that they need to have surgery. But what happens when surgical treatment options don't provide the relief that they're looking for? Dr. Alexis Jimenez is with Riverside Pain Physicians. He works with patients to find the best treatment options available. Dr. Jimenez, thank you so much for being here.
Thank you for having me here.
So let's dive into this a little bit on the broad spectrum, and then we'll get a little bit more into the back aspect of things. You are an interventional pain physician. Give us the definition of pain, you know, for people, because it's a broad term, but a lot of people suffer from pain, and it can be debilitating.
Yeah, so if you can imagine having pain 24/7, is something can get a big toll in your life. Pain is described as suffering, a sensation, a feeling, but it's actually linked to emotions. So as a pain physician, you're trained in different modalities of treatment. It goes from different medications to injections and other interventions. Pain is so big and so important, and people don't even realize it. The #1 cause of admission in a hospital is pain.
Yeah.
That's incredible, and the cost in U.S. is close to $100 billion.
Yeah.
So it's a big, big deal.
So if there was a place that you could go to get relief for your pain without having to go to the emergency room or having to go to some place like that. And also, some people don't realize that there are other options available for them. And one of the things specifically, and I know you brought a model with you to show that you specialize in, among other aspects, but is it spinal cord stimulation? What it's called SCS. What is that?
SCS. So it's a very fancy word, but in reality it's simple. It's been studied for 35 years. We have advanced regarding the technology and the pain relief that this device provides. It's simple. It just kind of a pacemaker device that it ends up being implanted on the patient. If it works, it transmits signals through these little catheters. These catheters is like an epidural catheter that are used for pregnancy when the patients are going to deliver the baby. It's the same concept. We put in through needles on the epidural space, and depending on the anatomic region where the patient are presenting pain, we know exactly where to put those leads. The leads just have electrodes at the tip, and that creates a sensation that the patient describes as vibration. So it's not, for example, if I have pain on my leg, now I'm going to feel vibration, pleasant vibration, so no more pain. So the pain that was present 24/7 now is just pleasantly taken care of.
Yeah. Well, yeah. What kind of relief does this then provide? And you kind of gave the short version of it. But for patients that come into your office and they have this procedure done, how life transforming is that for them?
So statistically, there are 40,000 trials. So trials are tests of the therapy, and they provide close to 70% of relief, which is significant.
Yeah. Oh, yeah.
Very significant. Of course, there's specific indications, and they have to be used in the specific and the right kind of patient.
Yeah, and I was just going to ask you, who is the right patient for this? Because I'm sure it's not one size fits all, that this will work for anyone with back pain.
Yes, I agree. It's very specific. There nerve pain, any kind of nerve pain. There's something very common called peripheral neuropathy, which is a fancy name for burning, tingling, and numbness that patients with diabetes have very commonly. That's something that we can treat very efficiently with this device. Patients that have had surgeries in the back, and they end up developing something called post-laminectomy syndrome, which is pain and discomfort and radiating down to the leg. It feels like numbing and tingling too. It could feel like burning pain going down the leg.
And that's something we're going to dive into in later segments as you guys come on, talking about failed back surgery syndrome, which you gave the really long word for that.
Correct. It's very fancy, post-laminectomy syndrome. But
this seems to be a big problem with people coming to see you.
And it's very common. It's very common, and there's a big percentage of patients that go through surgery and then end up developing this problem.
Yeah, and do you find that some of your patients will then go have back surgery and they're worse off than they were before they started?
That happens. That happens, yes.
And so here's the thing that I think a lot of people don't realize is that there's something that can be done to help relieve their pain. I know, and I bring my father up all the time. I never send this segment to him. But he has this sciatica. He's got the shooting pain down his leg. He has done nothing about it because he's so afraid to do something because he doesn't want to make it worse, like I said, with the surgery. So he deals with it. And I keep telling him, you don't have to deal with it. There's something that can be done about it.
Yes, hopefully we can convince him all these times.
I'm going to send him the segment one more time.
Yeah, and it's very common. You know, people are afraid of things that they don't know. But that's what we're here for. All my partners and myself, we just dedicate ourselves every day to try to help these kind of patients, you know.
And talk about the practice in Riverside Pain Physicians, and we have other physicians from from your establishment come on, anesthesiologists. Talk about the practice that you guys formed together and the difference you're making.
Yeah, so most of us were anesthesiologists, but we have neurologist-based specialists and physical therapy, medicine, rehabilitation doctor also, which is Dr. Kornick. We all are board certified in pain medicine, which means we all went through a fellowship, accredited fellowship, and took the boards to be able to be called board certified interventional pain physicians. We work together, we all know each other for a long, long time, and we're just proud of helping people in town.
Yeah, what is it like for you? And I've asked this to the other physicians who have come on to provide people with pain who have not had relief from pain for years.
Yeah, I always say that, you know, I treat pain as is high blood pressure or high cholesterol. They need medications, it's something chronic, but there's nothing better than having a patient that cannot function, that is very unhappy, and then after you do something, the patients are recovering their life back.
Dr. Jimenez, thank you so much, sir, for coming on. We appreciate it. We look forward to having you come back on in the future. And thanks so much to Riverside Pain Physicians. Let me say that again. Riverside Pain Physicians. It's my Monday. I got to go a little slower. Riverside Pain Physicians for sponsoring this segment. For more information about pain management, the physicians and their locations, you can go to riversidepainphysicians.com or you can call them. The number is there on your screen, 904-3